Today we will discuss Staph aureus infections, but really quickly, are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Staphylococcus aureus, often called staph, is a type of bacteria that can cause infections. It's commonly found on the skin and in the noses of healthy people. While it usually doesn't cause problems, it can lead to infections if it enters the body through cuts, wounds, or other openings. Common symptoms of a staph infection. 1. Skin infections, red, swollen bumps that may look like pimples or boils. They can be painful and may drain pus. 2. Fever. You might have a fever as your body fights the infection. 3. Warmth or redness. The infected area may feel warm to the touch and appear red. 4. Chest pain or cough. If the infection spreads to the lungs, it can cause symptoms similar to pneumonia. How to know if you have one? Look for symptoms. Check for the signs mentioned above, especially if you have a wound or cut. Monitor for fever. A high temperature can indicate an infection. See a doctor. If you notice any unusual bumps, persistent pain, or worsening symptoms, it's best to consult a healthcare professional. They may do tests to confirm if it's a staph infection. When to seek immediate help. If you have a severe infection, experience difficulty breathing, or have a rapid increase in symptoms, seek medical attention right away. Remember, early detection and treatment are key to managing staph infections effectively. If someone has a staph infection, here's what to do in simple steps. 1. Keep the area clean. Wash the infected area gently with soap and water. Pat it dry with a clean towel. 2. Cover the wound. Use a clean bandage to cover any cuts or sores to prevent spreading the infection. 3. Avoid touching. Don't touch the infected area or let others touch it. 4. Use over-the-counter pain relief. Take pain relievers like ibuprofen or acetaminophen to help with pain and fever. See a doctor. Visit a healthcare professional, especially if the infection looks severe, is spreading, or if you have a fever. 6. Follow doctor's advice. If prescribed antibiotics, take them as directed, even if you start feeling better. 7. Wash hands regularly. Wash hands often to prevent spreading the bacteria to others. By following these steps, you can help manage the infection and reduce the risk of spreading it. In the hospital, here's what doctors and nurses typically do to help someone with a staph infection. 1. Diagnosis. They check the infected area and may take samples, like swabs, to identify the bacteria. 2. Antibiotics. They give the person antibiotics through an IV, intravenous, or by mouth to fight the infection. 3. Wound care. If there are abscesses, pockets of pus, they may drain them to help the healing process. Monitor symptoms. Medical staff will keep an eye on vital signs like temperature and heart rate to ensure the person is improving. Fluids. They may provide fluids through an IV to keep the person hydrated. 6. Pain relief. They give medications to manage pain and discomfort. Education. Staff will teach the patient about care at home and preventing future infections. By doing these things, the hospital team works to treat the infection and help the person recover. Here are some common medications used to treat staph infections. 1. Antibiotics. Methicillin, often used for methicillin-sensitive Staphylococcus aureus, MSSA. Oxacillin, another option for MSSA infections. Nafcillin, typically used for serious infections caused by MSSA. Vancomycin, commonly used for methicillin-resistant Staphylococcus aureus, MRSA infections. Daptomycin, used for complicated skin infections, including MRSA. Clindamycin, effective for some skin infections and can be used for MRSA. Trimethoprim sulfamethoxazole Bactrim, often used for mild MRSA infections. 2. Pain relief. Ibuprofen helps reduce pain and inflammation. Acetaminophen, another option for managing pain and fever. These medications should only be used under the guidance of a healthcare professional. People who are at an increased risk of developing a staph infection include 1. Those with cuts or wounds. If you have open cuts or sores, it's easier for bacteria to enter your body. 2. Athletes. Those who participate in contact sports may be more likely to get infections due to skin contact. 3. People with weak immune systems. If your immune system is not strong due to conditions like diabetes, cancer, or taking certain medications, you're more susceptible. 4. Crowded places. Living in or visiting places like dorms, military barracks, or prisons can increase exposure to staph. 5. Poor hygiene. Not washing hands regularly or not keeping wounds clean can raise the risk. 6. Skin conditions. People with skin issues like eczema or psoriasis are more vulnerable to infections. 7. Intravenous drug users. Using needles can introduce bacteria into the body. These factors can make it easier for staph bacteria to cause an infection. Now you need to watch my video on COPD or have a look at pneumonia.